I now have the privilege to introduce the first session of the day, Addressing Air Pollution Nationally, Locally, and in the Clinic, featuring Laura Kate Bender as the moderator. Laura has spent more than a decade working for protections. Sorry, screen switched. Laura has spent more than a decade working for protections from air pollution and climate change. She currently serves as the National Assistant Vice President, Healthy Air at the American Lung Association, where she leads the Healthy Air campaign, directing advocacy initiatives in Washington, field staff working in multiple states, and coordination of a broad group of national public health and medical organizations. She previously served as the campaign's lead representative to Congress, advocating for limits on outdoor air pollution to protect public health. Prior to that, she worked in Virginia to implement the Healthy Air campaign on the state level. She also served on the board of the Virginia Asthma Coalition. Prior to joining the Lung Association, Laura worked as an organizer on clean air issues for Environment America. She studied political science and communications at American University in Washington, lives in Fairfax, Virginia with her husband and 2 children. With that, I'm going to pass it over to you, Laura. Thank you, everybody.
Thank you so much for the kind intro. I'm delighted to be here with you today. So this session is addressing air pollution nationally, locally, and in the clinic. And the way we're going to do that is I will begin by covering the federal level, so a couple of key federal air pollution issues that, of course, intersect closely with both climate change and health. And then I will turn it over to my co-presenter, who will cover the clinical level. So just to introduce you for a minute to Dr. Kari Nadeau. She is the Nadeau Professor of Medicine and Pediatrics. She's out of Stanford University. There's an extensive bio in the Medical Society Consortium program that's too long to list here, but she is a leading expert on allergy, asthma, and an advocate for climate change. So I'm very delighted to have the opportunity to co-present with her here. Next slide, please. So just to quickly walk you through what we hope to cover this session, or hope you'll take away from this session. First, we'll talk about the Clean Air Act, the impact of regulations under that law on air quality to date, and the cost benefit of those regulations. We'll share resources that people can access to learn about the quality of the air they're breathing in their community. We'll talk about how additional regulations under the Clean Air Act could further improve air quality, and we'll talk about how air quality affects people's health in the medical examining room. Next slide, please. So I will start out with a key resource that the Lung Association loves to make available called our State of the Air report. It comes out every April. So what I'm about to share is from the April 2021 report. The next report will be coming out in just about a month and a half, so look out for it. But this report is an annual report card on air quality. The goal is to present air pollution into everyday language that gives the public local information that's easy for them to understand about the quality of air pollution, the quality of the air and how it impacts their health. So we grade what they're breathing, not local communities' efforts to clean up, but what's in the air you're breathing. We look at 2 pollutants, ozone and particle pollution. Kari will be covering some additional information around the health impacts at the patient level, but from a big picture, these are both key public health issues and intersect closely with climate change. The report looks at air quality over the last few years that we have data, but then it also includes long-term trends, which I will talk about in just a moment. Next slide, please. So just to direct everyone to it when you have a moment, it's at lung.org/SOTA that currently has the current report starting in at the end of April. It will have next round of the report. But the website is the best place to access the information that covers your local community. So we look at communities across the country that have official air quality monitors funded by EPA or other agencies that collect information on ozone and particle pollution. We use that data to determine the grade. So I will note here that not everyone has a grade because not everyone has an official air quality monitor. But what we do have for every county in the country is information on the levels of populations that are most affected by air quality. So even if you don't have a grade, you will have an estimate for your county level number of adults with asthma, children with asthma, people with COPD, et cetera. Next slide, please. So a few key findings that we got from this year's report. So State of the Air 2021. First of all, more than 4 in 10 Americans live in places with unhealthy levels of air pollution. So that's 4 in 10 Americans that had grades for one of the pollutants that we look at. So either ozone pollution, short-term particle pollution, so spikes and unhealthy particles, or annual particle pollution. Those are the 3 grades we measure. Next slide, please. State of the Air 2021 also was an opportunity for us to place a strong emphasis on health equity and environmental justice. The report found that we looked again at 3 different grades for air quality. We found that people of color are 3 times more likely than white people to live in a county that got an F for all 3 measures. We also found that people of color are also more likely to live in a county that got any F. So there's clear disparities that are showing up in this report in the quality of the air people are breathing. Next slide, please. We also see that these are in keeping with climate change predictions. So I'm sure we've heard much this session, or much in previous sessions, as well as in previous conferences, about the effects of climate change on air quality, just to name a couple here. One, of course, wildfire conditions are increasing due to climate change, which leads to more wildfire smoke. 2, ozone pollution is actually formed in the atmosphere when emissions react in the presence of heat and sunlight. So more heat often means more ozone. And so in keeping with what we expected to see with regard to climate change, as we're seeing warmer temperatures, we are seeing upticks in air quality or air pollution levels. Next slide, please. So just to summarize a few of these findings, again, 4 in 10 Americans live with unhealthy levels of air pollution. There are clear environmental injustices and how that burden is distributed. And the overall note here is that the nation has made great progress in cleaning up the air over the course of this report. And I'll cover that in more depth in just a moment. But overall, the air is much cleaner than it was 20 years ago when we started doing the report, 50 years ago when the Clean Air Act was first passed. But we're seeing a little bit of that progress begin to be undone by climate change. And there are plenty of people, largely people of color, living in fence-line communities near polluting sources that haven't seen the benefits of the cleanup that much of the rest of the country has. Next slide, please. So as I said, the uptick of air quality is real. The Clean Air Act is working. So 51 years ago now, Congress passed the first ever Clean Air Act. It was the first ever set of federal measures that really provided tools to drive down air pollution across the country. Previously to that, it was largely in the hands of states. And as we all know, air pollution, it doesn't respect state lines. And so that approach just wasn't working. So under the Clean Air Act, and then under its 1990 amendments, which added additional really powerful tools to clean up air pollution across the country, the nation has made huge progress. So we have seen vehicles get a lot cleaner. We've seen particle pollution and the pollutants that react to form ozone dramatically reduced from the transportation sector, from the power sector, from other industries. We've seen a lot of our oldest, dirtiest equipment get off the road. Diesel trucks are much cleaner than they used to be. Cars are much cleaner than they used to be. So overall, again, the Clean Air Act is a huge success story, and I'll dive more into that in just a moment. But we have seen that increased wildfires and more heat leading to more ozone has led to an uptick in recent years. Now, I'll dive into a little bit more about what we know about the cost benefit of the Clean Air Act. Let's go to the next slide. All right, so first off, I want to share a snapshot from our State of the Air report. I mentioned that the report website has the grades for the most recent report for communities across the country, and then also trends. So here is DC. DC's trend line, this is the annual weighted average number of high ozone days. Essentially what that means is that the report looks at air pollution data in 3-year blocks, the 3 most recent years of quality assured data. So the most recent report covered 2017, 18, and 19. We do that to avoid having any one really warm or really cool year skew the data too much. And this looks at, when we say weighted average, we're looking at if there was a high ozone day and then how bad was the high ozone day. So for example, a red day counts for more than an orange day, given the additional impacts to health that it has. So this is the overall trend from when we started doing the report, which started looking at 1996 all the way to now. So you can see, obviously the air is much cleaner. EPA's national standard, which I'll talk more about in a bit, is the dark line across the bottom. So you can see that we're just about in the DC area, meeting our the national standard for what is considered safe to breathe for ozone. But there's a slight uptick at the very end, and we expect that given the predictions of climate change's increasing impact on heat and what that means for ozone, that could continue to swing back up and undo some of the progress that the area has made. Next slide, please. And then here's particulate matter. This is annual PM. So this is the day in, day out amount of particle pollution in the air on an average basis. Again, you can see the DC area has made enormous progress with a slight uptick at the end. Now, obviously, the East Coast has seen a little bit of the impacts of wildfire smoke on the West, but let's go to the next slide. But overall, the trends are clear that leading up to this point where we're seeing climate impacts, the Clean Air Act has been enormously beneficial. So the sort of gold standard report on this is EPA's 2011 report, Benefits and Costs of the Clean Air Act, second prospective study. It's a mouthful. There were other studies, but this is the one I point to most. So again, this is a 2011 report. It was at the time projecting out to 2020. So it was looking at what the Clean Air Act's regulations had already done, where they expected them to go, and what they expected that to mean for health. And so they predicted that in the year 2020 alone, there would be 230,000 premature deaths prevented, 2.4 million asthma exacerbations prevented, 5.4 million lost school days, and 17 million lost work days prevented all in 2020. Now, those benefits are, again, they projected out based on the regulations that EPA had put in place under the Clean Air Act within the authority of the law to reduce emissions. EPA also does a cost estimate. So their central benefits estimate, so not the high end and not the low end, was that the benefits would exceed the cost by 30 to 1. There is a lot more on the costs and benefits of cleaning up air pollution. So if anyone wants a more recent statistic or some additional examples, I'm more than happy to share them. Basically here, a lot of these benefits come from lives saved by preventing particle pollution related deaths. There are just enormous counts of lives saved by cleaning up particle pollution. And as you can imagine, there's lots that could be said that I won't dig into here about how EPA values a premature death prevented, but there are enormous health costs and then enormous costs associated with premature death that they're capturing with these benefits and costs compared to what it costs to comply with the Clean Air Act. Next slide, please. This is a great chart that EPA puts out every year. We use this chart at the Lung Association to illustrate that the air is getting cleaner while the economy is growing, that you don't have to choose between clean air, public health, and a healthy economy. So that top line is GDP. You can see that GDP has dramatically grown. That bottom line is its aggregate emissions. So there are 6 main pollutants that have national standards under the Clean Air Act: ozone, particle pollution, and 4 more. The aggregate emissions of those pollutants has gone dramatically down, even as not only has the economy risen, but so have vehicle miles traveled. So it's not just that we're driving less, and it's not just that the economy is going down. We're clearly able to make these gains while that's happening. Next slide, please. Okay, so now to dig into 2 quick ways that the Lung Association is pushing for EPA to further implement the Clean Air Act. The law is passed, it's in place, it's great. There's plenty that we need Congress to do when it comes to air pollution, climate change, and health, but the Clean Air Act does provide a framework for us to continue making big pollution reductions, even in the face of a changing climate. The first is the National Particle Pollution Standards. So I mentioned a few slides back on that chart that there was a line that said below this line passes, or below this line passes, which is the national standard. Essentially, part of what the Clean Air Act does is it provides for EPA to set national limits on a few common air pollutants, including ozone and particle pollution. Under the law, that limit has to be set on what the science says is healthy to breathe. So there's a lot of places in the law where regulations have to show that the benefits outweigh the costs, or that it's feasible, or that it's technology that's available. These are different. The National Particle Pollution Standards, as well as the National Ozone Standards, are required to be based on the health science. The idea is that EPA sets the national limit on how much of the ozone or how much of particle pollution is safe to breathe. And then in the implementation process, states and communities work with EPA to come up with a plan to meet those limits, but it puts health first. And that has been key to the dramatic emissions reductions that we've seen over the course of this law. However, The current limits on particle pollution, as well as ozone, but I'll focus on PM, are too weak. The science clearly shows that they allow levels of particulate matter that put patients' health at risk. In fact, the Lung Association and many of the organizations represented by those of you on the call today have been calling for stronger standards for many years now. We now have a chance to actually get them. EPA is currently, as the law requires, reviewing the standards. They have to review it every few years because the Clean Air Act recognized that the science was going to change. So they're reviewing the standards to see whether they want to strengthen them. They're currently in the middle of the process for reviewing the particulate matter standards, and they are beginning the process for reviewing the ozone standards. This is a huge opportunity. So, if we had a national updated PM standard, we could drive dramatic cleanup nationwide of the sources that contribute to particle pollution. The Lung Association specifically is calling for a stronger annual particulate matter standard of 8 micrograms per cubic meter. We're also calling them on EPA to strengthen the short term, that 24-hour spike in air pollution standard of 25 micrograms per cubic meter. And I mention this now because the Lung Associations will have plenty of action opportunities around this policy goal. We expect EPA to potentially propose a stronger standard in late summer. We are not going to wait. We are going to, starting in April, really begin pushing for that stronger standard and the scientific basis for it. And there'll be lots of opportunities for health professionals and health organizations to engage. So I offer this now as a preview. It'll be a huge priority because it has the potential to have a huge impact, not just for overall pollution levels nationwide, but to really drive cleanup in a lot of the communities that have been waiting for it for decades. Next slide, please. I want to note one other policy priority right now, and that is asking EPA to strengthen mercury and air toxic standards. So this is a separate part of the Clean Air Act, separate type of regulation, but EPA also has specific limits on types of sources of air pollution. One of those limits is the mercury and air toxic standards for power plants. So as you likely know well, coal and oil-fired power plants emit mercury that ends up in the water, that ends up in people's bodies by bioaccumulating through the fish they eat. There's other air toxics that come from power plants besides, volatile organic compounds, dangerous air toxics that are carcinogenic. So all this is to say, there's a current EPA opportunity. They are going through an action to shore up the current mercury and air toxic standards on a legal basis, but they've also cracked open the door to strengthening them. And even though there are current laws on the books that have dramatically reduced mercury and other air toxics, there's still work to do. There is certainly still an unacceptable level of toxic emissions coming from coal-fired power plants in particular. So you will have this link when you get the slides, but there is a current action opportunity for folks to sign in support of stronger limits on mercury and air toxics that I invite everyone to take. Next slide, please. Finally, a couple more quick things that you can pass along in case folks are interested, whether it's your patients or people in your community. Of course, please share lung.org/SOTA, the State of the Air Report. Of course, there are also great resources from EPA. So FireAirNow.gov is where you can get the forecast for your air quality levels for that day. Next slide, please. And then for those of you living in wildfire country, fire.airnow.gov is an EPA pilot project that uses data not just from its official monitors, but also from low-cost sensors like Purple Air monitors. That's particularly important as I'm sitting on the East Coast, so I know I don't have to tell those of you living with it, but the smoke often changes hour to hour at a faster rate than the official air monitors reflect it. So this is a way to get better information about, when it's safest to duck outside of your house to take your dog for a walk in a time of wildfire smoke. Next slide, please. So again, I'm here. I'm happy to answer questions. I've seen some great questions in the chat, which I will address after Kari gets the chance to go through her slides. I'll pull out the best questions and we'll leave time for a good Q&A session. If I don't get to your question in this session, I'm happy to follow up with you. And finally, one more resource is the Lung Association's Health Professionals for Clean Air and Climate Action page. It is a place where you can sign up to get our newsletter. We highlight advocacy opportunities for health professionals on clean air at the federal, state, and local level. Thank you so much. And with that, I will turn it over to Dr. Kari Nadeau. Again, she is the Medici Foundation Endowed Professor of Medicine and Pediatrics, Director of the Sean N. Parker Center for Allergy and Asthma Research at Stanford University, Section Chief in Asthma and Allergy at the Pulmonary Allergy and Critical Care Division at Stanford, and Senior Director of Clinical Research for the Division of Hospital Medicine. All in all, I love the way the program words it. She is one of the globe's foremost experts in adult and pediatric allergy, immunology, and asthma. Thank you so much, and I will hand it to you.
Thank you, Laura. Can everyone see my screen?
Yes.
Okay, great. Thanks. Well, it is a true honor and pleasure to be here today. And you've seen and spoken to so many wonderful, preeminent people in this field. And today I'll be talking about specific cases for the translation to advocacy and policy. And as Ed Maybach said so eloquently yesterday, we really are the voices of change, and we are the trusted voices. And within that lens, I want to talk about the solutions that we can give our patients and local communities, state and national and global communities that hope and promise that they can do something to help, and so can we. And this solutions figure was made by the World Health Organization recently and really talks about all these levels in which we can amplify and use our voices to act and advocate for climate change and health. And I want to speak to the first level. So all of us as healthcare professionals and healthcare trainees can use every intersection with patients and families as an opportunity to use our voices to educate and to implement change. So let me give you an example. This was a paper published by the Journal of Thoracic Disease in which it gave a great overview for what we can do on air pollution, mitigation, and adaptation. So specifically for personal mitigation of air pollution, one can use home air filtration, avoid pollutant environments, exercise with limitations, have a good diet and good health practices, stay indoors on appropriate days, as you've just heard from Laura Bender with the ALA State of the Air report. It's very helpful, and then use personal masks. And this example came up recently in my clinic where a 41-year-old mother of 5 came to my clinic with asthma and increased respiratory distress. And upon speaking to her about social determinants of health and really understanding her social situation, I learned that she and her family had recently moved within 100 meters of a major highway, which is a big risk for air pollution-induced disease. And she knew that. She had been on Google and researched this for her family. She was very worried because she and 2 of her children had allergic asthma, and with increased pollens and air pollution she and her family were breathing, they had, quote unquote, no place to breathe clean air. And with that, that serves as an inspiration and motivation, I think, for all of us as healthcare professionals to really understand how we can best converse with our patients. And for example, in this setting and in any setting, you should use these encounters to use your voice for advocacy for patients and families and to educate. And this is an example of patient materials on the MSC website, in which they beautifully mapped out the overlay, for example, of ragweed pollens and ozone in many parts of the countries. And these overlays are just going to get worse because in disease, when you have both air pollution as well as pollens, that not only adds to your disease, but it exponentially amplifies the way the immune system can respond and then cause disease and asthma exacerbation in our patients. And not only does that affect a single patient, but as we think about global warming and the increase in these pollutants, as Laura just mentioned, we know that our pollen season are increasing. And with global warming, we're seeing increase in pollens and increase in season length, and that will also increase allergies and asthma, unfortunately. But these are the types of conversations to have with our patients. But what about change? What can we do to help our patients personally behave differently to be able to help them adapt to these climate changes as well as, in this instance, air pollution and allergies? And so for this particular patient and their family and anyone that comes to me, I speak about air filters and what the appropriate settings are. And you can see here that with the different filters that one can obtain, that there are optimal filtrations to be able to decrease the risk of exposures to pollen, dust, dust mites, PET, cooking oil, indoor pollution. MERV13s are the best at the current time, but they're not optimal for other pollutants as well. So hopefully we'll get better, but this is the best filter we have at the current time. We also need to also need to talk to patients about how to use those filters and how old your home is. And so we, again, being those voices of change, need to educate ourselves on what these filters are and what their pros and cons are. Now let's talk about masks. So we know a lot about masks because of COVID, but importantly to think about how to best use them in the time of air pollution exposures and other toxicants. And so handmade masks, unfortunately, do not reduce the exposures to the diameter of particles that you just heard from Laura about that really affect the lung. And when we look at surgical masks, they also are not ideal. The best masks with the most efficiency are N95 masks. But as you know, as all healthcare professionals, you have to have them fitted around your nose appropriately, and they're not always adequate for children. So we still need to fight very hard to improve adaptation to air pollution for our patients and families. In this specific instance, going back to the patient, when I talked about filters and masks, the mother mentioned she could not afford them. And that inspired us and a group of doctors and other groups to ask local counties to provide free air filters for lower income families. And Lisa Patel and others have been involved in this. This was a recent paper published in August 2021 that indeed, thanks to RAMP and thanks to local communities, working with disenfranchised communities, we were able to improve the chances of families being able to get free air filters. We're not there yet, but we need to keep on pushing this and helping that health equity lens and making sure that we help environmental justice communities like Rachel Levine said yesterday. And in terms of follow-up, we were able to get this mom an air filter thanks to the RAMP program, and she's doing better and she continues to be followed. So that was an example on the patient level, but what about the local level? And this is an example of something that Dr. Lisa Patel and Mary Pernicki worked together with Michelle Berry at Stanford, and you don't necessarily have to do research or participate in these programs. This was open to the community as well to participate in this action lab for human and planetary health. And with that, you've heard a lot from me now about air filtration and masks, and that can be done on a personal level. But what about the schools? What about where there's a majority of children spending a lot of time in schools, especially during air pollution? And you just heard from Laura the increased risk of air pollution exposure in all populations across the US, but especially in vulnerable populations like children. We need to think about those exposures. And I just want to give a framework for those of you on the East Coast, where you might not know that in California, the schools are pretty open, that you go from one pod to another. Physical education courses are oftentimes outside. And with that, there's exposure due to air pollution and the bad air that they're breathing. And we needed to understand how we could teach parents and guardians to become advocates of change as well. So Lisa and others put together this program. And why I want to focus on this and highlight it is because we are voices of change. But in addition, we can amplify and multiply voices of change by working and explaining to parents and guardians what could affect their children. And oftentimes children's health will serve as a huge motivation factor and inspiration by which parents, teachers, guardians can then advocate for change at the local and state and regional and government level around the globe. So this program, for example, is teaching school boards to be ready and adapt to climate change. Another local level example was really implemented, thankfully, through the NIEHS and EPA Children's Environmental Health Centers back in the early 2000s and earlier than that. There were programs going around, thankfully, for the United States, and because of funding, we could think about pollution exposure in children and how that affected their health. And in this particular case, we worked with the University of California, Berkeley, and the public health school there to think about protecting kids from air pollution. And these, very importantly, were community-led collaborations. And I want to really highlight that we needed to go to the community before we did any understanding of how air pollution was affecting health in children. We met with the community several times, went down to the Central Valley in California. And as you heard from Laura today, that State of the Air report was really instrumental for us understanding where most of the communities that were being affected by air pollution were. And unfortunately, they were in the vulnerable populations, the disenfranchised populations in California, where most of the air pollution was being exposed to. And so we worked together with local state universities and institutions, and importantly, when we asked the community what they needed and what their questions were, we got the following. We want to know how air pollution affects my family, short-term and long-term, and what can we do about it? The community was ready to engage, and that was instrumental because we went to the high schools. This is a picture showing you the high school student who won the competition to put the symbol together of our study. But again, it's being advocates, it's working with the community, it's community-based focus and research studies, as well as advocating for them on the clinical level. And so over the years, we discovered through collaborative team science that over time, what was happening in people that had short-term and long-term pollution exposure was that their immune system was being changed in their genes. And unfortunately, that was very helpful to understand the mechanism by which pollution affected people's health to some degree. And the minute that we publish in the peer review literature, which is another example I want to show you today, is we talked to the media. We went out and made sure that we could get interviewed by their radio stations and importantly by their newspapers so that we can show and share our science with the community through their lens. And we went back to the community and continued to meet with the community every 3 months to share our science with them, because it really isn't important unless we have that impact and share it with the community and see their viewpoint. And I also want to talk about this story because it talks about how important it is to persevere. Because after this was published, the board for policymaking in the community of Fresno didn't immediately change their policies for buses and use filters, for example. They didn't immediately change their bus routes or their vehicle use. In fact, it took perseverance and tenacity and continuing to work with local community groups to be able to then, in about 3 years, have this be action-oriented to a result which was positive for the community, in which there was now zero emission buses and rollout plans. And this was also consistent with the governor's actions now that have occurred throughout the state. But I want to use this as an example where you can't just do work in the community and assume that one item will be able to move and implement change. We need to make sure that even if there are non-receptive audiences on the other side, we need to keep moving that conversation forward, keep not accepting no for an answer, don't give up, and make sure that good science is implemented towards sound policy. On the state level, I want to give you some examples as well that it's important to know that all of you can implement change and be that voice of change, even if you don't do research, even if you haven't been the one to write that paper. That's totally fine, because there are many papers in our literature that we learn as healthcare professionals how to interpret. And that interpretation is very important for our state legislative community. We're going to learn that on the national level tomorrow for many of us who are going to speak to our local representatives. But we have to come at it from their point of view, from their perspective. What are their questions? How do they see this changing? How can this improve their sustained relationship with their communities as representatives? And so what we will do as healthcare providers is go to Sacramento, go to our state legislative bodies when important policies are being discussed. We want to be there at the table. And so we'll take time out of our day to make sure that we're there. Oftentimes now we're asked to be there because they realize that we can interpret some of the things from the literature to be able to help state legislators make decisions. For example, for wildfires, which are really a scourge of the West, and their intensity is increasing as well as their frequency across many parts of the world, we wanted to understand to what degree you could use prescribed burns or controlled burns, which really eliminate a lot of the fuel sources at the ground level in the forest, to be able to reduce the spread and devastation of any given wildfire. And we talked to forest ecologists, talked to many people in multidisciplines to understand this framework so that when we went to the state legislator and we could understand the reduced risks overall of using prescribed burns compared to wildfire risks, we could then adequately explain to our policymakers. And then that helped our state legislative bodies increase the number of days that we're allowed to have for prescribed burns now, so that can reduce the devastation of wildfires. And things like this need to continue. We need to take the science, refine it, implement it, and use it in the language of policymakers to help provide policy-oriented outcomes. And then finally, as I mentioned, we can take what's in the literature and interpret it as healthcare professionals. We are all trained to do that. And policymakers aren't necessarily trained to do that. And as advocates, I think we should take that honor, that privilege, and that privilege is pressure. But importantly, the time is now to look at key evidence in the literature to be able to provide that hope and promise to our policymakers to affect change. This is an example at the national level where, for example, you heard from Gina McCarthy yesterday, who was the EPA administrator at the time, that in 2005, EPA's National Clean Diesel campaign required that vehicles purchased after 2006 use cleaner fuels. And this is an example of buses, and this is again just buses, showing that after the use of ultra-low diesel sulfur, specifically ultra-low sulfur diesel, that reduced the percent difference in asthma by almost 30% in those children that had persistent asthma that rode these same buses. And this is really important. This study was done in 2015. There are plenty more studies that have shown the improved health effects of a policy change, improving the health of respiratory disease, for example. And it's important to have these at our fingertips as our tool chest to be able to then implement change and show that by having national level regulations, by making sure the Clean Air Act is regulated appropriately. As you heard from Laura, there are many benefits that now have been used and are tangible and that we can use when we are out there in the field as advocates. And I want to just let everyone know, in that hope and promise that we are going to be using electric vehicles, that this will improve, I think, even more when we see the data from fully electric vehicles. Not stopping there, on the global level, I want to give you an example of a great story that I was able to glean from the late George Shultz, who was the Secretary of State at the time during the Montreal Protocol. And I really want to use this story as hope and promise that as we think about climate change and all the aspects that are going on around the world, we need to make sure that we can be that voice of change. As Ed Maybach said, that when physicians came together about nuclear war, that really had an effect on Michael Gorbachev, on other world leaders. And so in the same regard, when we think about the ozone hole in the stratosphere and the link to UV light associated diseases like skin cancer, when chlorofluorocarbons were being shown in the scientific and the clinical literature to be associated with disease and toxicity, the world leaders got together to think about banning CFCs. And unfortunately, there was a lot of cynicism, there was a lot of naysayers, and there were many people around the table that were not willing to pass this Montreal Protocol. But what apparently happened, what George Shultz was mentioning to me, is that over many days of discussions, what finally happened was that Ronald Reagan stopped the conversations for a coffee break and went from leader to leader to leader around the room and had discussions privately with them and asked them what were their main issues about passing this Montreal Protocol. And what came out was that they might not necessarily agree with the politics or the science, but what was the most important thing was that Ronald Reagan mentioned to them that if they did nothing, it would be much worse. That even if they had some question on the science, that importantly, he made a plea for the next generation that no matter what, by passing this Montreal Protocol, there was the possibility of helping their grandchildren, of helping their children. And that what George Shultz said is that that's what changed the room. That's what allowed the majority of the people to pass this ban. And so I want to show you that hope and promise of making sure that we can work with our health ministers, talk to what really makes them change their mind, meet them at the table. And you can see over time from 2006 to 2012, for example, now the ozone in the stratosphere is much less and that hole has been reduced. So I want to give that to you all as an example because we can be those voices of change. We can use the tools that are available to us as knowledgeable, trusted healthcare professionals to advocate and act now. So I want to summarize by encouraging you to all work together. We heard that from many of our speakers yesterday and will today, to train the future. As you heard from Jay Lemery, this fellowship is a fantastic example of that, and many education around medical schools and healthcare professionals now, as we heard from groups yesterday. We need to partner with stakeholders. We need to be able to think about communicating with groups that we not necessarily communicate with every day. We have to step out of our normal routine and make sure that we act to engage community and other stakeholders and be a voice of change. To invest in technology, products, and services that reduce climate change and improve health and protect our planet. And then we also need to identify vulnerable populations and track environmental exposure and health changes like we did in the case that I shared with you previously. And then to implement hazard mitigation and adaptation plans. If you get a chance, help your local governments, help your states to be able to think about mitigation and adaptation plans that actually make sense to the people that you're treating and the people that you're helping. To promote and support and advocate for health equity, I shared with you an example of a single mom who had 5 children all at home, who unfortunately had to move close to a highway. People don't necessarily have choices. We can help and support and advocate for health equity around decreasing their air pollution exposure and climate change effects on their health. We need to protect and help those that are most vulnerable, work with the community, and importantly, listen to the community, ask them what they need first, and then respond. And of course, prioritize clean energy as essential for preventive medicine. The benefits far outweigh the small amount of cost, as you heard from Laura, for the long-term benefits of our future. And then speak to policymakers like we are tomorrow, work with community leaders, and work with the media to help affect change. And I want to emphasize that through cleaner energy, we can help improve health. And your world depends on it. We are at a nexus point. We are on red alert. The IPCC report came out timely this past week, and many of the other resources available on the MSC website. I just want to highlight some of them here. We can learn from them. We can continually learn and advocate for change. I want to thank you for your time. Thank you to the Medical Society Consortium for this wonderful annual meeting. I want to appreciate all of our collaborators and the communities. So thank you for your time.
Thank you so much, Kari. I've seen some great questions in the chat. A few I have responded to individually, but I'll get through as many as I can here. First off, a category of questions, starting off with, could you direct us to the site or research that would allow us to calculate attribution of changes in our local air quality for local health status? And I think a broader question here around how do we help policymakers understand the benefits, cost benefits in terms of local air quality measures? Where do we point to show costs, and where do we point to show benefits at the local level? Kari, I'll let you start, and then I can add to it.
Yeah, thank you. There are a lot of great resources now. And I think importantly is that many of our colleagues in the literature, for example, the New England Journal, the Lancet, are putting out great articles to be able to have available to us to answer those questions. So what I can do, and we might not have all the time now, is I could put together with many colleagues, and I welcome people to join me, a sort of a group of key articles that you might be able to have in your tool chest. I know that many other places have them available, MSC, the ALA, as well as the EPA. The EPA has a really helpful website. The NIEHS does as well. There's a website in the Biden administration that you can get from health outcomes associated with air pollution. And then, for example, Ricky Pereira and others have some great articles on cost benefits. Now, in terms of your local community, there might not necessarily be a study in your specific local community around that. But again, being that voice of change, you can think about it. You can start asking those questions, being able to start studying that and affecting change. But yes, there is really a plethora that we can look at for resources for you to answer those questions, because they are available and many studies have been done to show the benefits due to policy changes and changes in air pollution measures.
I love that. Why don't we do a roundup? Because I see this question coming in from a few different places, and we'll get that out to everyone. I'll also add that consistently, We see even EPA does its own regulatory impact analyses when they put out a new air pollution standard. We consistently see that the benefits get underestimated and the costs of compliance get overestimated compared with what actually ends up happening. So for example, there's not with the Mercury Toxics standards, we don't actually have a good way to monetize the benefits of a lot of those reductions in toxic air pollution, but it's pretty clear that reduced cancer risk or reduced birth defect risk is is something worthy of pursuing in the regulatory sphere, even if we don't have an ability right now to put a number on it in our modeling. So I will know that these estimates typically undercount benefits because of health impacts that are hard to put a price on.
Absolutely. If anyone wants to know, and I think Ed Nadeau put this in the chat, that the University of Wisconsin and NRDC put a great report together on at least those papers that have come out on cost benefits, like Laura mentioned, that there are a few that you can tap into, and there is a report on that as well as many others. So thanks, Laura, for mentioning that.
Sure. Another one for you. Can you talk about the safety of DIY box fan filters? I know that's relevant to a lot of patients.
Yes, it is. That has continued to be observed and researched. I think any one filter we need to really be careful about. What are the best ones? So I am unsure as to how much research has been done specifically on the ability of those filters to reduce exposures and to improve health outcomes. But we need to continue to push these companies to make better filters. And of course, filters depend on the type of home that you have, the age of your home. If you're going to be filtering out air pollution, you shouldn't be opening up your window, and then those filters need to be changed over a period of time. So we also need to think about the cost. So thanks for bringing that up. But I think no one filter does it all. The volatile organic compounds, methane, other things that are going on in the indoor household also need to look at. So filters are filters, but importantly is to go upstream and think about how we can prevent greenhouse gas emissions and prevent toxic emissions from vehicles as well as indoor pollutants.
Great, thank you. I know we need to wrap up. There are so many good questions here. What I'll do is I'll hang out for a few minutes. I'll respond directly to a few of you, and then we hope to have that roundup of resources on air pollution health benefits should be really valuable that we'll put together. I want to thank everybody so much. We really appreciate your engagement and questions, and I will hand it back to my friends at the consortium.